Hi class, this is the first lecture for the cardiovascular system. You'll find these slides in Google Drive as well, and it will be the lecture titled Cardiovascular System, Structure of the Heart, and Circulation of Blood. So here you can see all of the different freeways in Southern California, and that's because the freeways kind of represent like the flow of traffic through the whole city, just like the blood vessels are the flow of blood through the entire body, and so there's that analogy. And then you also have the ships and other stuff like the trucks bringing things in, and then you have export of things going out. So you get the analogy. Anyways, so the essential question for this part of the lecture, and there are two parts in this lecture, is for this part, draw and label the parts of the heart using the vocabulary that you see here. So if by the end of the first half of this lecture you can answer this question using all of these words, then that means that you have probably mastered this concept. You can pause this recording at any time and read through the text of the slides and then resume it when you're ready. You can do the same for images too. Pause and look at the images, and then when you're ready, resume. I'm not going to read through the text. I don't think that's a good use of my time or your time when it comes to recordings. Instead, I'll be mainly working off of the images. So you should know that the heart is located in the middle part of your body. So here, if you look at the inset at the top, you can see where my cursor is. You have the clavicle right there. You have the sternum right there with all the ribs attached to it. And then behind those bones, you have the heart. And because this is along the midline of your body, we call that the medial region. And because it's behind the sternum, it's called the mediastinum. So once again, the heart is located in the mediastinum, which is the middle part of your body behind the sternum. And you can see the word mediastinum spelled in the previous slide. Here we have a transverse cross-section of your body. So imagine that you just took a sword and cut straight along, the middle of your body, parallel to the ground, and this is what you would see. Here's the spine, the vertebrae of your spine. Here is the right lung. Here is the left lung. And remember that right and left are flipped because we're looking at a mirror image of what your body looks like since we're looking at it from the anterior view. And then right there is your heart. And this would be one ventricular wall, another ventricular wall, and there would be the septum. Now, the reason why you would see the ventricular walls and the septum even when you do a transverse cross-section is because the heart actually is not oriented straight up and down. It's oriented on its side in your body. Here you can see the diaphragm, which is the muscle that controls your breathing. So when you contract the diaphragm, it pulls down, which then pulls a space open in your lungs, drawing air in, right? So the heart is actually resting on its inferior side on the diaphragm. And then there's the apex of the heart right there. So that's the pointy end of the heart. Here we have one atrium. And then over here, hidden by the pulmonary branch, we have the other atrium. And then down here, we have one ventricle and we have the other ventricle. Okay, so you can see that the heart is actually encased by a membrane called the pericardium. So if you were doing heart surgery, the first thing that you would want to do is to carefully peel back that pericardium, and that allows you to get to the heart wall underneath. The pericardium is the sac that wraps around the entire heart. It's made out of serous membrane, and it's filled with serous fluid. And that fluid protects the heart so that if you're jogging or whatever, you don't have the heart bumping against your lungs. The serous fluid is cushioning it so that it's protected. This pericardium, by the way, is what they cut away from my son's heart when he got his surgery back in December because he had a hole in the middle of his heart. And so the surgeon cut away a piece of the pericardium and used that to close the hole inside of my son's heart so that he wouldn't have an immune system reaction to the tissue used to close it since it's from his own tissue. That being said, You see this word pericarditis at the bottom of the slide. When you have a break in the pericardium, those patients will always be at increased risk of pericarditis. So that would be inflammation of the pericardium because of bacterial or viral infection, which can cause basically what we call an inflammatory cascade in the heart tissue, and then that can endanger the patient's heart function going forward. The heart wall itself is made of 3 layers. You have the epicardium here. You have the myocardium, which is the actual heart muscle. So this is one of the 3 types of muscles that you learned about last semester. Remember, there's skeletal muscle, smooth muscle, and cardiac muscle. So the myocardium is the cardiac muscle. And then you have the endocardium, which is that tissue that separates the myocardium from the blood that's flowing through the heart. External to that, you have the pericardium right here. Now, the pericardium is actually in 2 parts. There's this pericardium out here, and then there's this pericardium out here, and then this is also called the endocardium. It gets complicated. Here's all you really need to know. Myocardium, inner layer is the endocardium. External to that, you have a double layer of pericardium, and sandwiched in between is the serous fluid that cushions the heart. Whether you call this outer layer here, these parts, whether you call that epicardium or pericardium, I don't really care. In my class, we're mainly going to be calling it pericardium, even if your book uses the word epicardium. Okay, so here we've got the external heart anatomy, and let's go through them one by one. This is the right atrium. There's the left atrium. There's the right ventricle, and there's the left ventricle. And I want you to notice that we're looking at this view of the heart from the outside. So this is not a cutaway view. This is an external view. And right here, you can also see that you have these blood vessels that are lacing the outside of the heart, and they're also encased in fat. By the way, the more fat that you have surrounding your visceral organs like your heart, the more danger you have of heart disease and other issues. Okay, so moving on, we've got the superior vena cava and the inferior vena cava. And this is called the superior vena cava because it brings deoxygenated blood from your head and neck, so the superior regions of your body, into your right atrium. This is called the inferior vena cava because it brings deoxygenated blood from the inferior regions of your body, so your arms, legs, trunk, into the right atrium. And then from there, the blood flows into the right ventricle and then out through the pulmonary trunk, which is not labeled yet. Yeah, there it is. Okay, so the pulmonary trunk. So the deoxygenated blood will now go to your lungs, and then from there it will go back through those are the pulmonary arteries, by the way. So from there it will go back into the heart through the pulmonary veins. So there they are, number 11 and 12. The pulmonary veins now are bringing oxygenated blood into the left atrium, which then dumps the red oxygenated blood into the left ventricle, and then that blood exits through the aorta. And then these blood vessels here will take that oxygenated blood up to the head and neck, while the rest of the oxygenated blood goes down the aortic arch, down the descending aorta to feed the rest of your body. Those, number 13, are the coronary arteries. So blood is going to go out through the aorta and then through the coronary arteries to feed the heart itself. So the heart is pumping blood to itself, and then that blood becomes deoxygenated as the heart muscle uses the oxygen, and then you have the pulmonary veins, the cardiac veins. What have I been calling them? These are the coronary arteries. These are the cardiac or coronary veins, and they bring deoxygenated blood back into the vena cava. And then last of all, there's the apex of the heart. Okay, so you have the right side of the heart shown in blue, and you can see the vena cava is colored in blue. You have the left side of the heart, which for some reason here is also in blue, but it should be red. And that's because red blood is coming in through those pulmonary veins. and then that red blood will exit through the aorta. Now you'll notice that the pulmonary branch here is colored in purple, and that will sometimes happen in some images because they're trying to show that when red and blue mix, it makes purple. And when you have deoxygenated blood going to the lungs, it's already going to start becoming a little bit oxygenated. By the time it comes back through the pulmonary veins, they're fully oxygenated, and so now these are straight up reddish. Last of all, I want you to notice that you have the thick myocardium that makes up the ventricular walls. And notice that the left ventricle has thicker myocardium than the right ventricle. And that's because the left ventricle has to push the blood out with more force for reasons that we'll get to later on in this unit. You also have a lot of myocardium making up the septum, which separates the right and the left sides of the heart from each other. So to boil this down to 5 main points, you should know, here are your key takeaways, that when it comes to the structure of the heart is located medial to the lungs and anterior to the lungs in the mediastinum. The heart wall itself is composed of multiple layers, the epicardium, myocardium, endocardium, where the myocardium is made of cardiac muscle, and that's the one that actually pumps blood. And then the whole thing is surrounded by pericardium, where pericardium also includes the epicardium. It's unnecessarily complex, I know. And the pericardium is going to encase serous fluid that cushions the heart. You have 4 chambers in the heart. The upper 2 chambers are called the atria, the lower 2 are called the ventricles, and they're connected by the valves that we'll get to in our next part of this lecture. The left side of the heart is oxygen rich, the right side of the heart is oxygen poor, and they're separated from each other by the septum. And then last of all, that oxygen-rich side is going to send blood out to the rest of the body, while the oxygen-poor right side is going to bring in deoxygenated blood from the body and then send that to the lungs.